like this. Dang it, I did it wrong again. Do it again.
Just keep going.
Do it again.
Go.
Oh, I'm Dr. Xavier.
Wait, I said go while I was.
Hello, I'm Dr. Xavier, and this is a documented study on one of the patients here in Arkham Asylum named Harvey Dent, the self-proclaimed Two-Face. Harvey Dent is a 35-year-old male who is currently been the district attorney for Gotham. His current spouse is Miss Gilda Grace Dent. She is the one currently funding his psychiatric evaluation, and he suffers from a very serious injury, chemical injury, with burns on the left side of his face. As stated, we believe that these burns could be the cause for his behavior due to the immense chemicals that are still currently flowing through his body, and he exhibits very, very dissociative behavior. For instance, he has two conflicting sides of himself, or from what I can see. The way he makes conscious decisions is this little anxious reaction that he has, where he flips a coin to decide. From what I can see, these two sides are currently, going against one another. The patient has delusions that the right side may be trying to take out the right side, and through interviews with the patient, it is discovered that the patient has also undergone a long history of physical abuse from his father. This could also be a key factor in his behavior. So what I believe the patient is experiencing is dissociative identity disorder and a major post-traumatic stress disorder. The dissociative identity disorder is a severe form of dissociation, a mental process which produces a lack of connection in a person's thoughts, memories, feelings, actions, or sense of self. These symptoms are two or more conflicting personalities, which he does exhibit, inability to recall personal info beyond normal forgetfulness, which sometimes he does, auditory and visual hallucinations, which would be the delusions he has of himself, and the nightmares, and the, repressed memories from his father. PTSD is included in a new category in the DSM-5, traumatic and stress-related disorders. All of the conditions included in this classification require exposure to traumatic or stressful event as a diagnostic criterion, which could either be the chemical injury or his father's abuse. So he does meet every single one of these criteria. Exposure to threatened serious injury, which is the burns. Criteria B, the intrusions symptoms. Trauma persistently re-experienced, so those nightmares constantly emerging, stuff like that. Unwanted and accepting memories, Criteria C, avoidance, which is avoidance of trauma-related stimuli. So he does repress these thoughts and feelings. In fact, that is quite possibly why he he went through this mental breakthrough. Negative alterations in cognitions and moods, the right side of his self. Left. The left side of his self, which is the more violent and aggressor in this scenario. And criteria E, alterations in arousal and activity. So one way this happens is that somebody, is his choice decision, whether he wants to, let's say, harm an innocent. He would have these two conflicting sides constantly battling for some moral reason, one either being violent or the other being positive. And he does this by flipping coin. My patient in general is a more morally gray kind of person, but when his left side is in control, it's definitely this case. Criterion F, the duration. Yes, this has been going on for several months, and unfortunately, we have not been able to resolve this issue. Criteria G, functional significance. Symptoms create distress or functional impairment. Yes. This delusion that he has to make every choice by using a coin. Whenever he's deciding on something, it's whether he wants to do it or he doesn't want to do it. So let's say if he's eating, does he want to eat or does he not? This choice he completely decides upon by a coin flip, which is definitely not healthy in any sorts of way, and definitely reduces his functionality, as he's mostly pushing all of his cognitive skills into something other than his own mind. Criterion H, exclusion. Symptoms are not due to medication, substance, or... Well, yes, and kind of yes and no. These symptoms seem to stem from a very weak mind, but the substance use could have been the acid, but it's not. The acid wasn't a drug, so to say. That's a little hard to say. The two specifications, dissociative specification, meeting criteria for PTSD, an individual experiences high levels of either trauma-related stimuli, depersonalization, experience of being an outside observer or detached. Yes. He definitely sees things away from it. He's more of the kind of observer. He never really makes social. He's not very social in this world. He tends to be sort of a loner. Derealization, experience of unreality, or just yes. He does seem to not experience. He doesn't seem to experience reality the same way as we do. Especially when decision making, or when he's talking to the other side of himself. Delayed specification. Full diagnostic criteria are not met until at least 6 months after the trauma, although onset of symptoms may occur immediately. Treatment. Currently, there are still no known medications for DID, but we do recommend medications for his PTSD, at least to help make the psychotherapy easier on him, so he doesn't have any more sudden outbursts of his trauma. Hypnosis is definitely recommended as a way to just strengthen the psychotherapy. And that is all I have to say for this patient.